I think the one thing that I would say before you, if you're thinking about Mommy Makeover, the one thing you have to be certain of is that you're done having children. Because if you're not done having children, you can reverse the effects of the procedure. So I'd say first and foremost, before you investigate or have a consultation, make sure that you're satisfied that you've had enough children. It essentially is tightening the tummy, usually a tummy tuck of some variation, plus some type of breast rejuvenation, either a lift or an enhancement or a combination of both. Really have a procedure done at the weight that you're going to live the rest of your life. Now, being healthy and eating healthy is certainly going to help you recover and mend yourself from a procedure, but you don't want to get super skinny and not really be at the weight you're going to live the rest of your life and then gain weight after the procedure. On the other hand, you don't want to say, well, gee, I'm going to have this procedure, so I'm really going to pig out and get big and the doctor will take care of it. You really want to have the procedure at the weight you're going to spend the rest of your life, because it's going to have a longer lasting effect. Often things that are added along would be liposuction to the inner and outer thighs, and sometimes the posterior flanks. Sometimes arms can be added, and anytime that somebody goes to sleep, I'll always offer to do any injectables that they might otherwise get. If you're used to getting your lips injected and you have an opportunity to have that done while you're under an anesthetic, it's a good time to take advantage of that. Exparel, which was introduced about 5 years ago, it's a medication that's very similar to if you go to the dentist and you get injected and you're numb for 3 hours. Well, the Exparel, if we inject that and we do it ultrasound guided, so we get it right where the nerve endings are on your tummy, afterwards you'll be numb for 3 days. Now, we did a study here and we found that ladies that had that injection used only 1/3 the amount of pain pills as ladies who didn't have that injection. So if you're not using the narcotic pain pills, that means you're less nauseated, you're less constipated, you're not sick to your stomach, you're more mobile and moving around, you don't feel like you're in a fog. And so it really helps with recovery and has made it a lot more comfortable. Well, the surgery itself can vary depending on what's being done at a time, but typically it would be between 4.5 and maybe 5.5 hours, and that's really the upper limits of what we want to do as an outpatient. And we are still able to do that as an outpatient, and meaning you're going to be ambulatory and be able to get up and walk out when you're done. Patients are really recovering for a week, probably 10 days to 2 weeks before they're comfortably driving, and really not back to full activity, usually for about 4 weeks. The best time of year is probably when you have help with your children. So whether that's requiring your mother to come visit, or whether your spouse has to take some time off work, or whether your sister can come from out of town or whatever. It's whenever you can get the help. There's no seasonal advantage to this necessarily.